of the Dish with One Spoon Wampum Belt Covenant, an agreement between nations to peaceably share and care for the lands around the Great Lakes. At St. Joe's Healthcare Hamilton, we pledge to continue to walk together with Indigenous peoples in building a more just society where their gifts and those of all people are nurtured and honored. I'm Melissa Farrell. I'm the president here at St. Joseph's, and I want to thank Deputy Premier and Minister of Health Christine Elliott and MPP Donna Skelly for joining us here today. It's a privilege to have you both here. I'm especially happy to have you here, Minister Elliott, as you enter your last days as Minister of Health. We've been waiting anxiously for today's announcement because it will be a game changer for our community. This project has resonated with our donor community and garnered gifts from steadfast St. Joe supporters such as Leuna, the Sam and Roma Mercanti Foundation, an anonymous donor couple, and many, many more. We're pleased to have some of those supporters with us in the audience today. St. Joe's is Hamilton's only provider of emergency mental health services for those aged 17 and up. We provide services for a population of 1.4 million in Hamilton, Niagara, Brant, and Haldimand, making us the largest provider of mental health and addictions in our region and the second largest in the province. Our mental health emergency service has seen a steady increase in patient volumes of close to 10% each year. Wait times are surging and referrals from family doctors are on the rise, exacerbating an already at capacity system. With that said, we are experiencing some of our highest volumes this year compared to 2020, including some of the highest rates of urgent cases we have ever seen. It's imperative that we increase access to care, expand our programs and services, and better support those in crisis. The increase in mental illnesses resulting from the COVID-19 pandemic is now being viewed as the secondary or echo pandemic. Experts are predicting increasing rates of depression, stress, and anxiety, escalating cases of post-traumatic stress disorder, and higher numbers of substance use concerns as we all cope differently with the effects of the pandemic. Currently at St. Joe's, we provide emergency mental health care for over 4,000 patients and their families each and every year. These are members of our community. They come to us with a broad range of needs requiring specific care. Today, we struggle with the space in which we provide that care. A youth experiencing severe anxiety and pandemic attacks could be treated beside an adult experiencing a severe episode of psychosis or a senior with dementia who wanders. We wouldn't treat these patients in the same way, nor in the same space normally. The types of intervention and levels of care they need are radically different. As you can tell, we are at a critically important time for mental health care in our region, and I'm sure you'll all be ready to hear the details of this exciting announcement from the Minister. Minister Elliott, over to you.
Well, thank you very much, Melissa, and hello, everyone. I'm delighted to be in Hamilton today alongside my very good friend and colleague, MPP Skelly. MPP Skelly has been a strong advocate for families in Hamilton, championing projects that improve access to high-quality care. Thank you for welcoming me to the community. I also want to thank the teams at St. Joseph's Health System and St. Joseph's Healthcare Hamilton for providing exceptional care to patients, especially throughout the COVID-19 pandemic. This month, you celebrate 170 years of the Sisters of St. Joseph, whose healing mission guides the work that you do each and every day. Your commitment to providing compassionate, patient-centered care at every stage of a person's life is truly remarkable. Now, long before any of us had heard of COVID-19, remember those days faintly, our government made a commitment to end hallway health care and build a modern, connected mental health and addiction system. We know the pandemic has had an impact on the mental health of many individuals, leading to greatly increased demand for services. Here at St. Joseph's Healthcare Hamilton, the hospital has experienced an increase in urgent psychiatric care referrals. The last 2 years have shown us that we need a stronger, more resilient healthcare system, and that includes expanding mental health and addictions, services, and supports. So that is why I am very pleased to announce that our government is investing over $5 million to redevelop St. Joseph's Healthcare Hamilton's psychiatric emergency service. This is great news and certainly worth a clap. Thank you. This funding will help double emergency mental health and addiction services and ensure that the people of Hamilton and the surrounding area have access to high quality, compassionate care. The space next to the current emergency mental health department will be redeveloped into 2 patient care areas with separate entrances and new patient and family waiting rooms. I also want to thank the teams at St. Joseph's Health System and St. Joseph's Healthcare Hamilton for providing exceptional care to patients. With this work and with this addition, one will be for patients experiencing more severe mental health and addictions crises who need to be cared for in a more specialized environment. The other will be for patients who would benefit from other medical care and mental health supports. Through this project, we're making sure that patients get the right level of care in a comfortable and compassionate space that is close to home. So once again, thank you to everyone at St. Joseph's Health System and St. Joseph's Healthcare Hamilton for everything you do to ensure that patients get the care that they need. Together, and that includes all of us here today, we will build a more resilient mental health and addiction system so that everyone is supported on their journey to wellness. So thank you very much, and I would now like to turn it over to MPP Skelly to say a few words. Thank you very much.
Thank you, Minister, and good morning, everyone. And thank you all for coming out this morning for this amazing announcement. I am so pleased to be here at St. Joseph's Healthcare for this very exciting announcement, a $5 million investment to redevelop and double the capacity of the Emergency Mental Health Department. Our government is making significant mental health investments in Hamilton because, based on the data, Hamilton and surrounding region have been identified as a high growth need area. Unlike the previous government, Premier Doug Ford and Health Minister Christine Elliott prioritize capital investments where they are needed the most. Over the course of the pandemic, St. Joe's has experienced a spike in urgent psychiatric care referrals. The current physical space at St. Joe's no longer meets contemporary standards for psychiatric emergency care. Our government recognizes that with the increased volume, this setting needs to be renovated to provide the highest quality of care and to ensure the safety of patients and our staff members. We have identified the needs in Hamilton and are making investments so that individuals in crisis have access to the right level of care in a safe environment. And for individuals and families, high quality care will be provided in a comfortable space. I am so pleased that after years of neglect from the previous Liberal government, Hamilton is getting the investment in mental health emergency care it so desperately needs. And as our Premier has said, our government is getting it done. And before I hand it over to Dr. Lewis, I want to take a minute to thank Minister Elliott for her service. As most of you know, the Minister is not seeking re-election. But Minister, thank you for your dedication, your passion, your commitment to keeping Ontarians safe throughout the past 2 years. I can't imagine how it has been for you. Your calm, confident approach was the reassurance that we all needed through the past 2 years. You are truly a class act, and you will be greatly missed. So thank you. And now, over to Dr. Lewis. Thank you, Minister.
Oops. Thank you, Minister Elliott and MPP Donna Skelly. This is such an exciting day for St. Joe's and for our community. The redevelopment of our emergency mental health service at St. Joe's, made possible by today's announcement, will benefit more than 4,000 patients and their families who we serve each year.
We have heard from our patients that space matters, not just the functionality, but the environment and how it makes our patients feel. Having privacy, having family close by, and having a welcoming place to sit, think, and tell their story is all part of caring for someone as a complete person. In the new psychiatric emergency department, as you've heard, the physical space of the unit will double in size from 3,700 square feet to 7,700 square feet. And we will create 2 distinct areas tailored to the individual needs of our patients. One serving patients who are experiencing more severe mental health and addictions crises who need to be cared for in a more specialist setting. And another area for those who would benefit from a less intensive, quieter environment. We wish to create a space that is both comforting and safe for all our patients, and we will continue to work in tandem with our emergency department colleagues to ensure that our patients' medical and mental health needs are both addressed. The new space will have more windows to the outside, as we know that natural light is so very important to feelings of hope and recovery. There'll be dedicated spaces for families and other members of the patient support team. A design that allows for integration between learners, physicians, and other members of the clinical care team. Electronic switchable glazing on the glass doors of patient rooms to transition them from clear to opaque, which will ensure patient privacy and dignity. Soft, natural finishes and room furnishes that decrease sound transfer and are sensitive to the needs of older patients and those experiencing perceptual disturbance. As the second largest mental health care provider in Ontario, we owe it to the patients and families we serve to offer the very best patient experience. This redevelopment will provide the environmental changes needed to achieve this. And as Melissa said, it truly will be a game changer. I wanted to add my personal thanks to everyone here who has made this possible. The patients, families, staff, learners and donors who have advocated for this redevelopment, and to Minister Elliott, MPP Skelly and our donors for listening and making this happen. To highlight the need and our efforts and how our efforts are helping our community, I'd like to invite Ms. Samantha McCanty to the podium. Samantha is a lifelong Hamiltonian, the executive manager at McCanty Management Incorporated, a mental health advocate, and the author of the book Embracing Schizophrenia, which is incidentally available on Amazon and is a very good read.
Thank you for having me here today. I just want to say thank you to our community, to St. Joseph's Healthcare Hamilton, its foundation, and especially the Ministry of Health for their support of this important project. The space in which St. Joe's provides care for people matters. We need to give those in our community who are struggling with mental illness a respectable and safe place to receive care. I've said this before, and I will always say this. Every single person with a mental illness deserves the same opportunities as everyone else. The opportunity to seek help and to receive it without judgment in a safe space. And it makes me so hopeful to see this slowly happening in our community. This year, for the first time in my 20 years of having a mental illness, I feel like we are more open to strengthening those with mental illness, to conversations around mental illness, and to improving the services offered and the spaces within which those services are provided. I am so grateful to everyone who every day tries to improve our community. The work you do is noticed and appreciated. And if you wake up every day with that intention in your heart, I think that is what matters. Thank you.
We'll now take questions. Media, if you have a question, please line up behind me at the mic. And it's one question, one follow-up. Thank you.
Hi, Mr. Elliott.
Hi.
Thanks for stepping up there. So be having to call you out. Just have a question on behalf of my colleagues in Toronto.
Sure.
They talk about the city there pushing a campaign for third doses, more people to get third doses. And in places like the States, there's a lot of conversation about fourth doses and fourth doses that have been authorized. Does Ontario have a plan to roll out fourth doses?
Right now, we're waiting for advice from the National Advisory Committee on Immunization. They have come to some conclusions. Their report has not been released to us yet, but that is something that we will be studying along with the Chief Medical Officer of Health to determine what Ontario's position is going to be, whether it's going to be for older adults or whether for the general population, but we need to see NACI's guidance first.
Can I ask Melissa or somebody from the St. Joe's team just a quick one on just speaking more to this spike that you saw during COVID-19 and what the need is here in Hamilton?
In terms of this wave of the pandemic, yeah, what I can tell you is that we're seeing in the wastewater, we're seeing in terms of the test positivity rates, and we're seeing overall healthcare worker infection rates increase right now. What we haven't seen is anything, we haven't seen a spike yet in terms of hospitalizations or ICU demands at this point in time. We know those two are lagging indicators, so we are certainly concerned and watching the numbers very carefully and closely at this point in time, but that's the experience in Hamilton at the moment.
Thank you. That will conclude today's announcement if there's no more questions, and we will just take a group picture after.